Hospital administration is a subject which of course goes to our Sailesh Tripathi. He made lot of efforts and it's the first batch at RIMS. I was surprised to know that RIMS did not have the department of hospital administration once I joined here. We have gone into an era from scientific knowledge, rationality in 9th century to the era of molecular genetics, metabolomics, proteomics, genomics, and in 21st century, in era of molecular technology, broadly where the medical science is going to be changed in engineering way. But with the growing phase of medical sciences, probably medical sciences, the way medical sciences have grown over last 3 decades, probably nothing has grown on the earth in that pace. Of course, the world has grown vividly, I do not deny that. But the medical science has grown in a very prolific manner. Hospital administration today cannot be considered as only the department dealing with the biomedical waste, hospital waste, duty roster of nurses, duty roster of technicians, showing the patients, addressing the problems, because hospital is always an emergency. It has grown something beyond that, and Harshvardhan would be talking because he is a lawyer also. Today we have reached to the era where if you talk about the Western world, in US, 50% cases of medical negligence are dealt outside the court. Because this army of lawyers which has grown over the years is not getting the job, and they have been, a medical field is a field which has assigned them a very good job by offering the medical negligence cases which are rampant over last few decades throughout the globe. It's not only in India. India is fortunate that India still did not have that much burden of litigations pertaining to the medical negligence. Hospital administration will not remain confined, and I was going through some literature because I am a student of life, as I've already said. The people who go for litigations, particularly pertaining to the medical field, 30% of them consult to the lawyers. However, the 18 to 90% of them, these respondents, consult to doctors. As my ADA said, Dr. Seema Singh, he has good experience, that doctor is not only doctor. Doctor is a person who earns his bread butter by alleviating the pain of suffering. See the irony. Doctor is not only doctor. Doctor is a academician, doctor is a surgeon, doctor is a physician, doctor is a social worker, doctor is a politician, doctor having connection with the goons, sometimes if needed, the doctor can take work from them also. Doctor is a social activist, and doctor is one community which are beaten many times because of the negligence and because of non-negligence. So we are very tolerant breed, in fact. The era is coming when it would not only suffice to have only the knowledge of neurosurgery and skills of neurosurgery, skills of surgery, skills of cardiology. The era is going to change when one will have to keep the knowledge, robust knowledge of law also. I know I am a refined neurosurgeon. I need not to explain it here. But once it comes to the knowledge of the responsibilities, duties and commitments, I don't know anything. Do you know what are the rights of the patients? We treat them and let them go. We don't know. I was going through some paper. There are 26 types of the rights assigned to the patient. It's not only the compliance of the drug. It's not only the getting the prescription to the outdoor. It's not only taking the medicine. They bear so many responsibilities of right of conflict, keeping confidentiality. There are so many things have been assigned to even patients. So is about the legal aspect, criminal proceedings. What does the CRPC says about the medical negligence? I don't know anything. I don't know about the medical negligence. I do not know exactly how should I behave while consulting, while offering the consultation to a patient. The communication, the kind of communication. I was resident, I remember, I was explaining a serious patient, the kins of a serious patient, of head injury, that this patient is going to die maybe in 24 hours or so. And I was so crude, I confess it, I was so crude that by that time Professor P.N. Tandon, who was the father of neurosurgery, he just walked there. Standing in a corner, he kept on listening and he said, you have explained everything in a very authentic and academic manner. But my dear friend, you don't know as to how really you should explain the person who is going to die in 24 hours, how to convince the kins of the relatives. Those are the crux. Doctors needs to be very soft at place and very strong at place. So there are many things. Even the law will take maybe following few years or two. The hospital administration and MHA will not remain confined to MHA. Probably the other branches like law of torts, Harshvardhan might be knowing it. The criminal regulations pertaining to the malpractices, law in ethics, and the regulations, these are the subjects which are going to take shape in years to come. And the day would not be far when the super specialties training would also be started in hospital administration. That is how I look into that. There are many things we don't know. Do we know the criminal liabilities of doctors? Do we know how to deal with if you are caught into the criminal liabilities? What are the safety measures? Do you know the consent appropriately? Do we know the record keeping? Record, my God. I was going through the text and I found we know only the record keeping, history taking, examination, investigation, treatment offered and follow-up. That's all. There are 49 types of the records available in literature. Those are to be kept. So there are many things. I mean, negligence, finding evidence, medico-legal, transplantation act, medical termination of pregnancy act, Consumer Protection Act, Psychiatric Patients Act. There are several acts available where you are bound with the law. So what I wish to convey that it is our first batch at RIMS, and kudo goes obviously to Dr. Shailesh Tripathi. The MHA should not remain confined only to the hospital administration. It should come out from the confined boundaries, and probably the time will come when the super specialty training as in other specialties have been started. The lawyers and different kinds of the medico-legal experts. Yes, I did not touch the aspect of the medical. Medico-legal is not, the jurisprudence is not the hospital administration, neither it is a law, it is a subject of the medical specialty. However, the time has come when the law will also shape in hospital administration, it will manifest in hospital administration, because the hospital administrator bubbling with the knowledge of law, advocacy, having the knowledge of hospital administration, rules, regulations, Swami book, and what is that called as financial book. All knowledge is required, and doctors is the breed who can have all the knowledge, and they are known to have different kinds of the knowledge. So already everything has been said. Thank you very much for listening me and tolerating me for these many minutes. Thank you all.